Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Dee. I'm one of the pharmacists here at Marley Drug Pharmacy. Today we will be talking about RSV, also known as Respiratory Syncytial Virus. It is a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but RSV can be very serious. How is it transmitted? It is spread through direct contact. This can include droplets from a cough or sneeze contacting your eyes, nose, or mouth. Also, touching a surface and then touching your face with unwashed hands can also lead to RSV. What are some symptoms? People infected with RSV usually show symptoms within 4 to 6 days after getting infected. These symptoms usually appear in stages and not all at once. In very young infants with RSV, the symptoms may be irritability, decreased activity, and breathing difficulties. Some other symptoms include runny nose, decreased appetite, coughing, sneezing, fever, and wheezing. How can you best manage your symptoms of RSV? Manage fever and pain with over-the-counter fever reducers and pain relievers such as acetaminophen or Tylenol or ibuprofen. Never give aspirin to children. Drink enough fluids. It is important for people with RSV infection to drink enough fluids to prevent dehydration or loss of body fluids. Talk to your healthcare provider before giving your child non-prescription cold medicines. Some medicines contain ingredients that are not good for your kids. What are some everyday preventative measures you can take to limit the spread of RSV? You can take everyday prevention measures to help reduce the spread of RSV and other respiratory illnesses. First, stay at home when you're sick. You want to cover your coughs and sneezes with a tissue or your shirt sleeve and not your hands, just like this. Wash your hands often with soap and water for at least 20 seconds. Avoid touching your face with your unwashed hands. Avoid close contact with others, such as kissing, shaking hands, and sharing cups and eating utensils. You also want to clean frequently touched surfaces such as doorknobs and mobile devices. Now let's dig into the RSV vaccine. RSV immunizations are recommended only for the following groups. Adults who are over 60. There are 2 RSV vaccines, RSV and Abrezvo, and they have been both licensed by FDA and recommended by CDC for adults ages 60 and older using shared clinical decision making. The second group is pregnant women. One RSV vaccine, Abrezvo, has been licensed and recommended during weeks 32 through 36 of pregnancy to protect infants. The third group of people are infants and some young children. An RSV preventative antibody has been licensed and recommended for infants and some young children. A dose of RSV antibody is recommended for children between the ages of 8 and 19 months entering their second RSV season who are at least in one of these groups. Children who have chronic lung disease from being born prematurely, children who are severely immunocompromised, children with cystic fibrosis who have severe disease, American Indian and Alaskan Native children. Who should not get the RSV vaccine? People with minor illnesses such as cold can be vaccinated. People who are moderately or severely ill should usually wait until they recover to get immunized. What are some side effects of RSV? You can have pain, redness, and swelling where the shot is given, feeling tired, fever, headache, nausea, diarrhea, muscle, or joint pain. Like all medications and clinical diseases, you should speak to your pharmacist or your healthcare provider about any questions you have. There's lots of information on other medications on our website. Check out the links below. Bye for now.